Welcome to our show Health and Wellness, Myths and Facts. A few weeks back, it seemed that the COVID pandemic was in its last stages and we were hopeful that it will end soon. But the emergence of Omicron has thrown all our projections of 2022 into disarray. Even though we have a variant which causes a mild infection, it can affect the vulnerable and the unvaccinated population. Due to Omicron's high rate of transmission and danger to unvaccinated and unboosted people, hospitalizations could rise dramatically in the coming months. People with chronic diseases should be more careful about the management of their conditions during this phase. The diagnosis and prompt treatment of various diseases can radically improve alternatives for the medical treatment of the patient. Regular monitoring of blood glucose or blood pressure can save patients from long-term complications. Innovative care solutions were sparked by the desire of patients to avoid unnecessary exposure to the novel coronavirus, along with interest in reducing the cost of travel and avoiding long waiting times while increasing communication with clinicians. With new technologies, there come many confusions regarding it. So let's talk to experts and clear our doubts. Let me introduce the panel to you. We have with us Dr. S Arun, MBBS, MD, PG Diab, consultant physician and diabetologist, Royal Care Super Speciality Hospital, Coimbatore. And we have with us Dr. Anup Taksande, MBBS, MD, Internal Medicine, DM Cardiology, Cardiologist, Wokhad Hospitals, Mumbai. Thank you so much, doctors, for joining us today. Let me start with you first, Dr. Arun. Some reports state that the SARS-CoV Omicron variant displays genetic similarities to a common cold. Is it true? And if yes, shouldn't we be overly concerned about this new variant Omicron?
Oh, that's not exactly true, because if you look at the genetic matching, it's much more closely matched to the SARS-CoV-2 virus. So it has got no basic connection to the common cold. And two, we have got a few patients who have also died worldwide due to Omicron too. So nobody dies of common cold. So this myth that Omicron is like a common cold needs to go. So it is, of course, less infectious, as you said before. At this point of time, it does appear that the infection is more confined to the upper respiratory tract, meaning in the nose and the throat. And we are getting fewer patients who are hospitalized. The hospitalization days are less, and the severity and the death rates are also low. But it's much too early to say, so we need to have all the COVID-specific precautions that we need to follow. And remember that if someone gets COVID, there's no way of knowing that it's only Omicron. It could still be Delta, which is a predominant variant. And as you have said before, even though Omicron is very less virulent, at this point of time, it still can be much severe in some of the patients, elderly patients and patients who have got some other conditions like heart condition, kidney condition, etc. So we need to be on our guard. So we can't treat Omicron like common cold.
Absolutely. I think that's a very important point out there, Dr. Arun, that we shouldn't take it lightly and yes, must keep up our guards. Dr. Taksande, in patients with existing comorbidities, like Dr. Arun was also saying, we shouldn't take it lightly. Omicron can cause the underlying illness to flare up. What impact can Omicron cause in people with pre-existing heart ailments?
Right. So what we know about Omicron is it's very highly infectious, but typically has low symptoms and lower need for ventilator and lower mortality. As is true with any kind of viral illness, patients with a lot of comorbidities like hypertension, diabetes, heart failure patients have a high risk of complications. And what was our experience with the previous Delta waves, patients with pre-existing heart failure, kidney ailment patients, hypertensives, diabetic, they were the patients who had higher mortality, higher death rate, and higher need for ventilatory support. Especially in heart patients, the effect of the virus is directly in the heart muscles, which causes inflammation of the heart muscle, which is called as the myocarditis. At the same time, it causes increased stickiness of the vessel wall, increased stickiness of the platelets and the red blood cells, leading to the clots, especially in the venous system. So we can get clot in the legs, you can get clots in the lungs, especially in the coronary circulation also. With the limited experience in the Omicron variant, we are still in the initial few weeks. The good news is that it probably has a very lower rate and the lower need for ventilatory support. Mm-hmm. But it's very important to understand that we should not let our guards down. It's very pertinent to understand the dictum that lesser the viral load that you are exposed to, the lesser are the chances of the complications. And the mixed co-infection with Delta variant getting reported, I think it's important, very important to keep our guards up and the mask up all the time.
Absolutely. At this point, I think maintaining COVID protocol is extremely critical. Dr. Arun, children and teens are still unvaccinated. What impact can Omicron have on them? And can we see a new onset of diabetes or hypertension in the young adults after this third wave?
Yeah, that's right, because currently we don't have our children vaccinated as of now, and we are just starting to vaccinate our teens. So it's quite natural that this variant is more prevalent amongst this population. But as of now, so from what we have seen so far, there doesn't seem to be a huge amount of concern regarding the severity of the illness in this age group. Because we basically don't hospitalize them, and most of the COVID medicines that we have for adults still can't be used with these people. But all the same, even if you have these patients in this age group, if they are, say, for example, very obese, they have an underlying condition, medical condition, it can still provoke a very severe infection in these people. Okay. As regarding the possibility of these patients developing diabetes and hypertension, it's actually low. So you have only patients who are already obese or pre-diabetic. These are the patients who can get full-blown diabetes after an infection. It's extremely unlikely for this virus to provoke diabetes or hypertension in a healthy adult.
Okay. Sure, okay. Okay, Dr. Taksande, tell us that some people are already suffering from the long COVID effect. What precautions should these people take to fight against the new variant Omicron?
All right, I think it's an interesting question. Some patients who had a COVID-19 infection and after their recovery continue to experience symptoms, and if it persists for more than 4 weeks, they are the typical long haulers, and it's called as a post-COVID-19 syndrome. As is true, patients with a lot of comorbidities, the elderly patients and hypertensive and diabetic, are the ones who develop this post-COVID-19 syndrome more frequently. The common symptoms are extreme fatigability, joint aches, or shortness of breath, which they continue to experience despite the oxygen level being normal, which in the medical terminology is called as an chronic fatigue syndrome. Apart from the physical symptoms, a lot of mental stressors like panic, anxiety, and fear of reinfection like happens in such patients, which our mental health experts can call this condition as a post-traumatic stress disorder. And general practices like having a very balanced meal, keeping your mask on, maintaining social distancing, and having a good night's sleep, and having a positive outlook, all help in preventing reinfection. Yes, reinfection can lead to a lot of physical stress, but a lot more of mental stress in such patients.
I think those are some important points that you have put out there. Dr. Arun, regular blood glucose monitoring is an important factor in diabetes management. What is the difference really between self-monitoring of blood glucose, which is SMBG, and assisted monitoring of blood glucose, which is AMBG? So tell us, for which category of people is self-monitoring of blood glucose more applicable?
Yeah, so self-monitoring of blood glucose is something when the patient himself or herself measures his own blood glucose all by himself without any assistance. If somebody else does that, it's an assisted monitoring of blood glucose. Basically, they're all the same. So we recommend self-monitoring of blood glucose in all patients with diabetes. So especially in this era of pandemic where they cannot access the hospital often. So it's extremely vital that they do that, because not only it helps them control the blood sugar, it gets the patient involved in the treatment protocol. So they can very well see how their diet, their exercise influences the amount of blood glucose, and they can make behavioral adjustments according to that. When you talk about an assisted blood glucose monitoring, it happens in a hospital setting where the patient is sick and somebody else does this monitoring for him. So these are two diverse populations. So in most of these patients, in fact all of the patients with diabetes, we advocate and recommend self blood glucose monitoring. One, it helps them manage the disease. Two, it helps them involved in the decision making.
Okay, thanks for that. Okay, Dr. Taksande, just going back to the basics, right, to understand a little bit about this variant, can you tell us that if somebody is, it is winter, it's time of flu, cold, cough, a lot of people are having that, are facing that problem. One doesn't really know when to get the test done. Should they immediately self-isolate or quarantine themselves? Can you just tell us a little bit about that?
I think so, yes. Whenever you have symptoms and you are in that high-risk category, I think you look at the saturation, you look at your pretty much symptoms, and I think so it's very important to self-isolate. That goes without saying. And if you are in that high-risk category, I think so get your testing done. And if there is a need for hospitalization, if the physician feels like you are in that high-risk category which needs to be hospitalized, I think yes, definitely. You need to isolate, you need to keep your mask on, and you should be socially responsible. And if there is a need for admission, definitely get admitted. And get yourself observed for 4 to 5 days, whatever the physician feels like.
Okay, that's really well explained. Thank you for actually saying that. I think social responsibility is something we must keep in mind. If there are any sort of symptoms, we must isolate, and of course keep maintaining the COVID protocol, wear our masks socially. So those are some important points. So we're going to be taking a short break. We'll be right back. Welcome back. You're watching Health and Wellness, Myths versus Facts. Starting with you again, Dr. Taksande, tell us what is the difference between monitoring blood pressure using a home digital monitor as opposed to getting a reading when one visits or gets it done at the doctor's? Are digital blood pressure monitors accurate?
All right. I think it's an interesting question again. And digital blood pressure instruments monitors are pretty accurate nowadays, especially if they're well standardized and well calibrated from time to time. Office blood pressure is like the blood pressure recorded during your visit to the doctors, especially in stressed out individuals, especially in anxious individuals, can be erroneously high. And then there is always this tendency to overtreat them, or they can be labeled as hypertensive patients, especially if they're not. To overcome this problem, especially in young patients, we advocate which is called as a 24 hours ambulatory blood pressure monitoring, wherein a patient carries a device for 24 hours and we get to understand the trend throughout the day and night, which gives us very accurate reading, accurate trend for 24 hours, helps in establishing the diagnosis and treating them with appropriate medications. Home blood pressure monitors, especially with digital monitors, can be especially useful in anxious individuals, wherein there can be a disparity between the home blood pressure and the office blood pressure. Patient can easily record their blood pressure from the comfort of their home, and they can be pretty sure about the overall control of the blood pressure. So we do recommend home blood pressure monitoring for such patients, in whom there is definitely a good choice in elderlies as well as anxious patient, and very true in COVID times.
Yes, I think that's good to hear that the home blood pressure monitoring units are also equally accurate, and it does keep a check on your blood pressure, that controls that. Dr. Arun, since we've understood about high blood pressure monitors, tell us, there are new technologies like insulin pumps, which have made life easier for people with diabetes. What is the advantage of an insulin pump? Who does it benefit? And is it really affordable in our country?
Yeah, that's a good question, actually. But if we look at the answer to this, we need to understand basically that amongst the multiple types of diabetes, that's type 1 and type 2, which is the basic. So we need insulin to reduce our blood sugars. In type 1 diabetes, which occurs unfortunately in younger individuals, for some reason they lose all the cells which secrete insulin. Whereas in type 2 individuals, they have some degree of cells which secrete insulin. So you need to replace insulin to bring down the blood sugars. So in type 1, they are absolutely dependent on the insulin that we give. So without the insulin, they cannot live. So these are these patients who will benefit immensely from insulin pump. So this is a very small computerized device which can mimic the normal secretion of insulin. So meaning when you talk about the normal secretion of insulin, you have a small basal secretion all the time. So meaning you'll require insulin whether you eat or not. And when you eat, you need a little more insulin. So insulin pumps try to do that. So it gives you a basal insulin and then gives you a programmed increased insulin during the meals. And similarly, in type 2 individuals also, there are some people who are extremely brittle with their control. So you give them a little bit extra, they become very high blood sugars, and you give them much lower, and they again lose the control. So these are some of the subset of patients in type 2 diabetes who can benefit from insulin pump. So it's still a bit expensive now. So it's about 1 to 4 lakhs depending on the customization.
Okay.
So it's probably not for everyone. So this is probably more ideal for type 1 diabetes and a very small subset of type 2 diabetes.
Okay. Thank you for explaining that really well, Dr. Arun. Okay, Dr. Taksande, tell us the availability of portable and home-based electrocardiography, which is ECG, is an important medical innovation which has the potential to transform medical care. How accurate are the readings and is it user-friendly?
It definitely is user-friendly. And technology is playing such a huge role in the way we have been diagnosing diseases and accurately correlating it with the symptoms that the patient has. One of the pioneers have been the wearable wristwatches, which actually diagnose the rhythm pretty well. And they are US FDA approved for detecting abnormal heart rhythm like atrial fibrillation and various electrical conduction heart blocks. Again, we have to understand that these wearable devices or the home-based ECG recorders that we usually have, they are good for rhythm monitoring. They can actually give an accurate indication for the rhythm of the patient. It's not a device for knowing whether you are having a heart attack, because it can't accurately detect any kind of heart attack or any kind of ischemic heart disease symptoms or its changes on the ECG. So yes, we need to understand the limitations of these wearable devices as well, but it's pretty useful for patients with palpitations or irregular heartbeat in such individuals in which the symptoms occur sporadically or infrequently, and in which the routine hospital visits may actually demonstrate that the ECG is normal during any hospital visit. So I think so. This is a field which has just started. I think so. It has better days to come.
Great. So we've understood a lot about technology, blood pressure machines, the insulin pump, and also the ECG, how you can do it at home. Okay, that's about technology. Coming to you, Dr. Arun, I would like to ask you, if an individual has diabetes, what approaches can help maintain target glucose levels? Insulin or oral medications? What is the better approach? Because there's a lot of confusion about this as well.
Yeah, exactly. So if you look back at what I discussed earlier, so we have two types of diabetes. The one, type 1 diabetes, where they simply do not have enough insulin, and type 2 diabetes where they seem to have some degree of insulin, but there's some mechanism which prevents it from working optimally. So it follows that in type 1, you need to give them insulin. So without insulin, they can't live. Whereas in type 2, they do have some insulin, but you need to actually make that insulin work better. Interestingly, rather than medicines, even a healthy diet and exercise can make insulin work better. So that's probably the way to go and start in type 2 diabetes, and then move on to medications. So basically what we're looking at is that type 1 diabetes requires insulin for their survival, whereas in type 2 diabetes, the treatment is highly individualized. In fact, no two diabetic patients are alike. So some of them might respond just to good lifestyle modifications, and some of them require a couple more, some of them may require insulin. So it's highly individualized.
I think that's an important point out there about highly individualized, and also what you said about managing it really well, whether it's exercise, eating the right kind of food, and of course, medication. Dr. Taksande, which cardiac tests should a healthy person perform regularly? Can regular monitoring through these tests help to prevent a heart attack or cardiac arrest? Because that is something we've been seeing a lot more now.
Right. I think so. It's like very important. And the old adage is like prevention is always better than cure. I think it's very important in the cardiac disease as well. And we have been hearing very unfortunate news of TV actors and film actors as well dying pretty young after gymming. There have been unfortunate incidences, right? But yes, like certain blood tests, like meeting just what I can say, the CBC or the renal function as well as the liver functions, looking at your sugars, fasting, post-meal, HbA1c, looking at the cholesterol levels in the form of lipid profile. These are the basic tests which every individual above 45, male and female, should routinely perform at least yearly, if not 6 monthly. Apart from that, in high-risk individuals who have family history, who do smoking and other things, it's important to an ECG look at the 2D echocardiogram, which gives us an idea about the heart muscle functioning, the pressures, the pumping efficiency. As well, doing a treadmill test once in 2 years is also a good way to understand whether we are prone to have any kind of heart ailment in the future. All these tests are very necessary, I think so, especially in this kind of urban or stressful lifestyles, especially in the COVID times that we are living in, to perform regularly. And yes, we get to understand a lot of conditions which can be prevented by doing appropriate therapies like angiography and angioplasty and later, so on and so forth.
Sure, thank you so much. Obviously, prevention is always better than cure. Thank you so much, Dr. Arun and Dr. Taksande, for speaking with us, explaining us everything really well and clearing so many doubts of ours. Thank you all so much, and thanks so much for watching.